so we're going to move right into our next presentation with Awake DBT. We're very honored to have them here today. Let me see if I have some light to read this. I'd like to first introduce Renee Sanguinetti. She is a licensed marriage and family therapist. In 2016, Renee became one of the first DBT Linehan Board of Certification certified DBT clinicians. She completed her initial intensive training in DBT in 2009, which was led by the creator and founder of DBT, Marsha Linehan. Renee continues her education and receives ongoing DBT consultation with Dr. Sherry Manning, who has been treating clients in DBT for over 20 years. Renee is the co-founder of Awake DBT. Renee has successfully treated adults, families, and children with varying degrees of mental health issues through her work at Momentum for Mental Health and the Bill Wilson Center prior to initiating her private practice in 2009. Renee received her master's degree in counseling psychology from the Institute of Transpersonal Psychology and received a certificate in creative expression for her expressive arts work. She is a member of and good standing in the California Association of Marriage and Family Therapists. Yvette is a licensed marriage and family therapist with over 12 years of clinical experience. She has completed an intensive training process through behavioral health tech in dialectical behavioral therapy. She is currently pursuing a certification in DBT. Yvette continues to be updated with advanced DBT trainings and techniques. She currently has a thriving DBT training and practice and is co-founder of Awake DBT. So at this time, I would like to welcome Yvette and Renee.
Thanks so much for having us here today. We're excited to share our work with you, and we hope that you become a fan of DBT like we are. Let's see. So today, we're going to give you just a little bit of an overview of DBT, talk a smidge about certification, all the research that supports DBT as an evidence-based practice. Yvette's going to talk about our program, and I'll talk just a little bit about a few outcomes that we think are important for you to know about, and share a little bit from our clients. And then we're going to hopefully have time to do a little bit of experiential, give you a couple skills, so you get a taste of what we do. I think we have about 48 skills that we teach our clients, so we're hoping to leave one or two with you today. So I thought I would just start by letting you see Marsha Linehan, who is the creator and developer of dialectical behavior therapy. She's a researcher at the University of Washington up in Seattle, and she created this fabulous treatment.
I started working with highly suicidal people. As it turned out, the people met criteria for borderline personality disorder, but A, I had never heard of borderline personality disorder, and B, I didn't know what it was. Even if you told me the name, I wouldn't have known. So that was the beginning of the whole thing. I had no idea what I was doing, except that I was studying suicide. What happened was standard behavior therapy of the 1970s and early 1980 blew up. And the main reason it did is because what it requires for it to work is for a person to come in and you be able to say, okay, here's the problem and here's what we'll do to change it. And for the person to say, okay, I'll try that. But the people I was dealing with immediately said, you're saying I'm the problem. And so they were so sensitive to any invalidation or statement that they were the problem that the treatment blew up. And they would either get angry at me, hide behind a chair, storm out, quit therapy, yell and scream, cry, or say they're going to kill themselves. So it didn't take me too long to figure out this was not going to work out. So I thought, okay, we're going to switch to a more acceptance-based treatment. So I'm going to validate and be very accepting. So I tried that. That blew up also, because then the patient said, you mean you're not going to help me? You're just going to listen to me? Most of the patients I treat have already been through a whole lot of therapy where you talk, get listened to, and understood. The problem is talking, being listened to, and being understood doesn't necessarily make anything change. So then they got really upset with me because I wasn't helping them change. So that's when I realized that I had to pull together a major emphasis on change with a technology of acceptance. So I had a technology of change, now I needed a technology of acceptance. The technology of acceptance primarily was validation. So it's behavior therapy with a huge amount of validation. So problem solving, validation are the core components of the treatment.
Okay. Yay, it went back. Okay. So as Marsha Linehan said, this is how she started working with suicidal folks, people coming right out of the hospital, people in hospitals. So just to give you a little bit, because it is much more complex than just validation and change, but it's comprehensive treatment. It is a behavioral intervention, but we have stages of treatment, we have modes of treatment, and we have a hierarchy within our treatment. So it's very layered, it's very complex. So originally, again, it designed to treat folks with severe mental disorders, out of control thoughts, feelings, and behavior patterns. And it's typically known as a treatment for borderline personality disorder, as well as high-risk folks, suicidality, self-harm behaviors, that kind of thing. But I'm hoping as we talk to you today, you'll see that it's further reaching than that. So DBT is also seen as effective for working with folks who have challenges regulating their emotions, the ups and downs, as well as challenges in thought patterns, behavior patterns, emotion patterns. We're looking at all those behaviors. So that's just a little bit of an overview, and Yvette's going to talk a little bit more about what we do. Just quickly to talk about certification, Jeannie mentioned that I'm certified. There's 2 people certified south of Menlo Park, and I'm one. And Yvette is this close to being the next person certified. Basically, the certification happened just a few years ago. Dr. Marsha Linehan wanted to provide the public at large, just to ensure the public at large that when you go to a treatment program in San Jose, California, it's going to be the same treatment as you receive in New York or Miami or wherever. So it's a very rigorous process that we went through just to make sure that we're doing the treatment as it was designed, as it was, this is, and I'll talk more about the evidence-based part of it, but just making sure each program that we're doing the treatment as it was designed so that we're adherent, we're following the fidelity of the model. And then looking at programs, looking at individuals within the programs. So for our team, Awake DBT, as I said, I'm certified. Yvette's really close. All of my team are on track to certification. I have one of our team members studying for the exam, and just this year they started program certification. They just launched it like a month ago. So we'll be applying for program certification this year. And that's a little bit about certification. So I want to just touch upon the research. So Marsha Linehan started doing research studies back in the early 90s about DBT. So I think I've counted like over 120 studies that I've looked at where they kind of slice and dice, what is this treatment good for? What are the populations? What are the people that benefit from treatment? So it is seen as, of course, evidence-based and effective for working with folks with borderline personality disorder, as well as folks with suicidal ideation, attempts, self-harm, all that good stuff. But what you may or may not know is that DBT is also an evidence-based treatment for folks with substance abuse, intractable depression, meaning med-resistant depression. And again, these are all based on peer-reviewed and randomized trials. Treatment as usual versus DBT and looking at big studies. Anxiety, DBT, a huge part of what we do is mindfulness. So we've all seen the benefits of mindfulness for anxiety. So with eating disorders, most of the research has been on bulimia, not anorexia, PTSD, and Yvette's going to talk a little bit more about how we do our PTSD treatment. With the bipolar study, they didn't have a huge sample size, but we actually see a lot of folks in our program with bipolar disorder. They're coming in to help regulate those emotions of the ups and downs, so DBT is kind of the perfect treatment. And then OCD. There also have been some studies on the skills group only component, which is quite rare, and it's really based on where the client is in treatment in terms of stage of treatment as well as their current symptoms. So just a few more diagnoses and symptoms that DBT has proven to help. So I guess I'm wanting you to think of DBT in a broader way. That we now look at DBT helping people multiple problems in multiple areas of their lives. And they could be people that have multiple diagnoses. Some might say they're difficult to treat. I don't know that I see that at all. But we have kind of a spectrum of people that come to us, from the very suicidal, self-harming, high risk, high crisis, lots of crisis calls, all the way through people that are just coming because they've got depression, they've got anxiety, they might have had some trauma. We kind of, we think of the DBT skills helping all of us every day. They're wonderful life skills, and we use them every day. But and they're starting to actually try to bring the DBT skills in earlier and earlier, like into middle school and all that. So the one other thing just to note is that our dropout rate is much lower than treatment as usual. So the cool thing there is when people come to treatment, they stay longer, so they have more time to learn the skills and benefit and integrate it into their lives. Now Yvette is going to talk about our program.
I am really, wow, wait a minute, am I on? Yes. I am really excited to talk about Awake DBT, and I'm really proud of the work that we're doing here. Awake DBT is a comprehensive DBT treatment, and with that we work with our individual clients weekly for 50-minute sessions, and then we also have skills groups, which they attend for 2 hours. And we do 24/7 crisis coaching to patients. And I think some of you may relate to that or are familiar with that. And anytime, day, we're available. And we also have a consultation team that supports us. In addition to that, kind of keeps us holding to the fidelity of the model. And we also consult with Dr. Sherry Manning, who has been doing DBT how many years?
22 or 23?
Yeah, I love it when she brings that up. So, as we're moving on to what else we do in stage 2, we talk about PTSD treatment, which is an evidence-based practice. It's prolonged exposure, which we call PE, DBT. And the outcomes when doing this with post-traumatic stress disorder is 71 to 80% remission rates. And there's 2.4 less likely attempts suicide after the treatment. And it improves depression, anxiety, trauma-related cognitions, and overall functioning. With Awake DBT skills, we teach life skills to the clients. And I can also say benefit from it ourselves as well. So that includes mindfulness skills, and mindfulness skills helps a person stay present in their lives and not in the past or the future. It helps them feel connected and able to live life fully. Distress tolerance skills are when you're feeling high distress. These skills are really helpful to decrease the distress level and not create new problems, because sometimes when we're in distress, we can create new problems and not meaning to acting on the behaviors. So, and emotional regulation is actually decreasing those vulnerability factors. It increases emotion regulation and the ability to actually have more, be in the driver's seat, more in control in your life. Last but not least is interpersonal effectiveness skills. With interpersonal effectiveness skills, Marcia thinks of everything, doesn't she? She's just covering them all. With interpersonal effectiveness skills, we're working on assertive training, help the person being able to assert themselves, ask for what they need, so they're keeping their sense of self-respect and keeping the relationship as well. And we have some wonderful skills that help a person get their life back. So in individual therapy, we work on helping clients generalize the skills to everyday life. And when we say generalize to everyday life, we mean within context of their home life, work life, maybe even out in the community. So the skills are transferable from place to place. And they're building emotional resiliency. They're beginning to feel good about themselves and making choices instead of acting and reacting from emotional vulnerability factors. And it's building assertive skills, helping them to ask for what they need. Overall, what we work with clients individually is helping them achieve a life worth living. And we don't take that lightly. It's helping them live a life mindfully and creating that happiness in their life that they're wanting to have. And that helps them take steps towards a more meaningful life. And it's been an honor for me, and I know for you, to watch people start changing their language, saying things like, oh, that's not effective, or that is effective. Yes, this seems to be working for me. I think I'll use my distress tolerance skills in this, so it's just fabulous to watch that. The other programs that we currently are working at Awake DBT is an art therapy DBT pilot program, and it's definitely exploring the arts and with DBT so that they walk away with a tangential piece of the work that they're doing and have something to remember and remind them. We also have a friends and family group / workshop that we have done and working on so that we support the community of the person we're working with and the family members, friends. They gather the skills and learn as well. And it's very fascinating to watch some of the stories that come up on how people are feeling more connected to their loved ones. We also have a graduate group where, let's say they've done DBT a while, and they're forgetting some of the skills. It's been a while. So this kind of keeps the skills fresh in their mind. So at Awake DBT, these are the clients that we serve in group. We have 2 adult groups that we meet per week, and that can range anywhere from people 18 to 60, 70. It's just spectrum there. We have 2 young adult groups for the transitional from going from high school to entering adult life. We have 2 of those as well. So, and an adolescent group, which you also call our multifamily group, one 13 to 15 and the other 15 to 17. And this is where the parent actually comes in and joins the group as well. So they're learning the skills along with their loved one. And we also offer family sessions where both the people are learning the skills and working as a couple.
All right, thank you. Okay, just a couple outcomes I wanted to highlight for you. So I don't know if this is good news or bad news that we're at the hospital, but there's 33% reduction in admission to psychiatric hospitals versus treatment as usual in the year after DBT treatment. And this comes from a study in 2010. This is linked to the research I was mentioning earlier. And then this next one is from the APA, that treatment costs decreased by $26,000 per year in the year of DBT treatment. If I could just translate that to all the insurance company people to make decisions for us to get our treatment authorized, that would be amazing. And then there's just some top line here about the great outcomes about reducing suicide attempts, ideation, self-harm, etc. But there's a bullet here from a couple different studies around the bulimia, and then there's one study I listed here on substances with the opiate use reduction. The last point I really wanted to highlight is that DBT plus meds, so skills and pills and skills, achieves remission from major depressive disorder faster than meds alone. I really like to highlight that one. Okay, so we just wanted to share a couple of comments from clients that we've worked with that have come through our program. I can't decide which one to share. There's so many good things. Okay, so this is the top one. I feel so much more comfortable in the world, even when things aren't perfect. And when I don't feel great, DBT skills really do help. And then I have the tools and confidence in myself to get through stress, and I'm exponentially happier for it. And then I'll just jump down to this bottom quote. I'm so glad I found Awake DBT. The skills I learned through the program and the follow-up one-on-one sessions have been life-changing. So for Yvette and I, we get to see change all the time. And like when people come in and they're just kind of starting to learn the skills, they kind of like, they're trying everything on. And there's a certain part we kind of joke around saying, oh, they turn the corner, is when we really start seeing clients get the skills into their daily life and see change. And it's really rewarding. We get to see it, but it's also fabulous when the clients see it for themselves. Because sometimes they don't see all the change and progress that they've been making. Okay, we thought we'd do a little practice. And I think we have the time to do it. So if time permits, we're going to give you a skill or a concept from each of our 4 modules, starting with mindfulness. So Yvette's going to take us through a little mindfulness practice right now. I hope you guys are game. Go for it. Okay.
Are you ready? Okay. So with the mindfulness practice, what we're going to practice is an awakened stance as I go through the mindfulness. And what that usually consists of is your feet are grounded and your body is in an alert position and yet comfortable in the seat that you're in. So as we're moving into the mindfulness, I want you to imagine just letting go of today, letting go of all the chatter and things that have happened. But you might want to remember Dr. Nanja's presentation, but no, letting go of the day or things that you have to do in the evening. And just rivet your mind to this moment. You can kind of tune into the sounds around you. So turn inward to the sound of your breath and focus on your breathing. Now, focus your attention on your body touching the chair you sit in. Consider how that chair accepts you totally. It holds you, supports you, and keeps you from falling down on the floor. Notice how the chair does not throw you off, saying you're too fat or you're too thin or not right. Notice how accepting the chair is of you. Focus your attention on the floor holding up the chair. Consider the kindness of the floor holding you up, keeping your feet out of the dirt, providing a path for you to get to other things. Notice the walls enclosing you in a room, so everyone goes by, doesn't hear everything you're saying. Consider the kindness of the walls. Notice the ceiling, keeping the rain and the winter cold and that wind from beating down on you. Consider the kindness of the ceiling. As you breathe, allow yourself to be held by the chair, held by the floor, and held by the walls and the ceiling. Notice the kindness.
I feel like we need a gong.
And slowly coming back to this present moment and rivet your attention to Renee speaking.
I kind of feel bad moving into a cognitive piece after having a mindfulness skill, but we'll do another mindfulness in a little bit. So I'm going to talk about a skill that comes from our emotion regulation module. There's so much that we cover in emotion regulation about learning how emotions work, how to have resiliency, how to increase positive emotions, increase negative. So this concept is in the section of our module where we're teaching about changing emotion. kind of shifting out of emotion. And this is one of a couple different skills we teach around changing. So, and I'm sure you guys all know this, but a lot of times our emotions are set off by our thoughts and our interpretations of events rather than the events themselves. Who's with me? Okay, so sometimes we have an event, and then we have a thought about the event, and the thought cues lots of emotion. Or sometimes our emotions can have big effects. So we have an event, and then we feel the emotion, and then we have thoughts about that, which can fuel other emotions, other thoughts. There's like a loop that happens sometimes. So what we're doing with this skill is really examining the thought. We're going to check the facts. We're going to work to neutralize the emotion, but also sometimes we just change out of the emotion altogether. So sometimes it's reducing, sometimes it's shifting us to a neutral, calmer place, which is a beautiful thing. So I thought I would just do an example, and we'll kind of walk through the questions to give you a sense or a little bit of a taste of how we go about doing checking the facts. So here's an example of an event. So my husband comes home from work, and I ask him, how was your day? And this is my interpretation, right? But he replies in a curt, terse, one-word reply, fine. So what happens? I have an emotion. Now this one isn't super huge, maybe some mild irritation. I mean, for each of you, it'll be different, right? And how that would be for you. So the way we go through the process is we first ask ourselves, what's the emotion that I want to change? And it's really important to identify the emotion name, because the research shows if you can name it, it actually reduces the intensity of the emotion, or it's starting to bring the intensity of the emotion down. So we kind of jokingly say, if you can name it, you can tame it. So we start with, what's the emotion I want to change? So in this example, I said mild irritation. And then we move on to the second question, which is, what is the prompting event? And I got to get the tone to really have you guys get this. Here's my here's how I define a prompting event. Well, gosh, I just asked him about his day. Jeez. Did you guys hear some tone and some judgment in my voice? That's right, that was there. So what we're doing in the second one, when we're fact-checking, is we're looking at our language, our tone, the words we use, how we use them. So I'm going to neutralize it by checking the facts. We're going to use a skill from mindfulness. We call it the describe skill. It's just describing what we take in through our senses. Okay, so here's my reframe from, I just asked about his day, to, I asked him about his day. He replied saying, fine. I observed a heightened intensity in his tone. So do you guys think that that would neutralize or change the emotion a little bit? I got a couple nods, okay. I'm hoping. So sometimes we're done right here. We do just a reframe on the prompting event and how we look at it, and that can change our emotion right there. If that doesn't do the trick, we move on to the next question, which is number 3. What are my interpretations, thoughts, and assumptions about the event? So here's mine. Could be that maybe he's mad at me. But what we're doing in fact-checking is we're looking for all the other possibilities that could be happening as well. So maybe he was stuck in traffic. Maybe there was a conflict at work. For my husband, maybe he was on the phone with his mother, and sometimes that'll create some emotion for him. So what we're doing is we're just looking at all the possible, we're trying to look at it from all different angles. And then what we're going to do here also is, if we can, we're going to test our hypotheses. So I can say to him, you know, are you okay? Are you mad at me? I mean, I could do something like that to fact check, just like really check in, like, what's happening for you right now? And hopefully we'll just receive the answer and we're done and we go on with our day and our emotions regulated. A lot of times it's really in number 3 that the hardcore nuts and bolts of fact checking really happen in our interpretations and assumptions. But if not, we move on to number 4. So it could be that I'm assuming a threat. So you're going to identify, what is the threat? What's the threat? He's mad at me, it's tense, whatever. What we're going to do is we're going to label the threat and we're going to assess the probability. How likely is it that he's super mad at me or something like that? So you're going to just do that to try to neutralize or change the emotion. And linked to that is, what's the catastrophe? What is the worst possible thing ever that can happen? And Marshall Linehan would say, like, using a skill from later in emotion regulation, doing imaginal rehearsal and seeing ourselves bring in all the skills we have from all of our different modules and seeing ourselves ride through the catastrophe smoothly, simply, and easily. And then lastly, if we still haven't yet changed the emotion, we're going to ask ourselves, does my emotion and the intensity of the emotion fit the facts? So in this example, like on a 1 to 10, and maybe my experience of this one wasn't huge, maybe it was like a 4, mild irritation, or 5. And maybe someone else might experience a 3, and so maybe mine's a little bit heightened. Does that make sense? When it's kind of bigger than what the situation warrants? And that just leads us to our next skill in the module, which is called opposite action. So it's just requiring a different skill to use to help reduce the intensity of the emotion. So that just gives you a little taste of fact-checking. Does that kind of get the sense of it? Okay, great. So next, we're going to show a video. Do you want to do a lead-in to the video?
Sure,
Okay.
I would love to. So we're going to show a video by Marsha Linehan on radical acceptance, and I just want to say the idea that radical acceptance is total and complete acceptance of this moment as it is, without pushing it away. And it's accepting reality with facts.
Okay, here we go.
I've been transformed by the very therapy that I developed. Because once I realized that I had to teach the clients acceptance, I realized at that very same moment in my own personal life, I had somehow lost my ability to accept, and that I was going to have to learn it myself. And so I ended up taking a sabbatical point or time off from my job. What I found out when I went to the first Buddhist monastery was within days I knew that I had found exactly what my clients needed. I had no doubts about it. I figured that out right away. That acceptance was exactly what they needed, but that they had a way of teaching it that I could translate. My problem was I tried to take it stock and barrel to my clients. At Shasta Abbey, the basic message was all the time to try to radically accept everything and to let go of desires and what you want. So we got jobs every single morning. And so it was the idea of practicing letting go of wanting a particular job. If you were sweeping, they would tell you when the bell rang for work to stop, they would tell you, stop in the middle, because finishing is just your own thing. You're trying to do something you want to do, just let go. So it was this whole practice of just constantly, moment by moment, letting go of what you want and radically accepting what is. It was the first environment I'd ever been in. It was completely non-sexist. I thought I'd died and gone to heaven. I'm not kidding. It was so unbelievable. Men and women would get the same jobs. There was no real distinction. I mean, admittedly, it may not have been helpful if I hadn't just completely thrown myself into it. But since I decided ahead of time that I had to learn this, my only option was just to do everything I was told. Just throw myself in. And I was a student, so there were 8 of us. We did everything together. It was really the practice of letting go of having to have what you wanted at any moment. And the recognition that you didn't have to always have whatever it was you wanted. That had a big effect in some ways on the therapy, that in the sense that I try to teach clients, suppressing what you want is not the way to go. You have to radically accept that you want something you don't have, and it's not a catastrophe. And so I stayed there for 2 months. Then I went to Germany to the Catholic priest. It was actually the first time in my life I ever talked to someone who actually understood me, the spiritual part of me. Given that my spiritual part of myself is the core of myself, more central than anything else about me, having that understood was an amazing experience. It had a transformative effect on me. What it did is it gave me a home. I am now convinced that it was the practice of radical acceptance every moment that will transform you. I don't have the slightest doubt. It would transform everyone. But it has to be a regular practice. And radical acceptance doesn't mean you don't try to change things, because you only have to radically accept the moment that you're in and the past. But you can try to change the next moment. you can't change anything if you don't accept it, because if you don't accept it, you'll try to change something else that you think is reality. So radical acceptance is simply the radical acceptance that reality is what it is. And if you want to change it, then you work on changing it, which is perfectly legitimate also. But I think it's hard to change something if you don't accept it in the first place.
Gotta love Marcia. That concept and that skill is probably one of our most challenging, if not the most challenging concept to teach and practice and have clients embrace and bring into their lives. So I'm going to shift us a little bit to interpersonal effectiveness. So in this module, as Yvette has shared, this is about assertiveness skills and all that. So what we're doing initially is looking at goals in interpersonal communications. This isn't just like an everyday, like pass the salt kind of thing, but like important conversations. We're going to look at objectives of the conversation. We're going to look at the relationship, and we're going to look at self-respect. So I'm going to quickly kind of define them, and then I'm going to give you a little challenge to work on. So objectives effectiveness, or the bucket of objectives effectiveness, is when we are obtaining our legitimate rights, we are getting another person to do something that we're asking them to do, we're being able to say no when someone asks us and we don't want to do something, and having the ability to do that. In this bucket is also just resolving a conflict, or lastly, just having someone hear you, like really get what you're saying, just listen, like really just hear me. So all of that we define as objectives effectiveness. So that's kind of one bucket. Another bucket is the relationship. How important is the relationship to me with the person that I'm talking to? So say I'm asking someone for something, but it's a relationship I really care about, or maybe it's a little bit tenuous. You have to kind of evaluate how important is it to me. We want to act in a way that the person keeps liking and respecting us. We want to balance my immediate goal, the thing that I'm asking for, with the good of the relationship. Sometimes we can get in that immediate gratification thing and look at the short term and not the long term of the relationship. And then it's about nurturing the relationships that are important to us. And then moving on to the third bucket of self-respect effectiveness. Can't say enough about self-respect effectiveness. It's basically, how do you feel about you at the end of a conversation? So kind of like, I want to feel good about how I handled myself in the conversation, or maybe I didn't escalate in volume or intensity. I want to, some people just don't want to cry in a conversation, be able to get through the conversation. But it's basically getting through a conversation and feeling good about how you handled it. So respecting your own values and beliefs, acting in a way that makes you feel moral, acting in a way that makes you feel capable and effective. So we're looking at all three of these things in interpersonal situations: the objective, the relationship, and the self-respect. And what we're doing is we're asking our clients to rank them in their priorities based on whatever the situation is. So I'm going to give you a scenario or two, and I'm going to have you guys, and please know there's no right answer, there's no wrong answer. It's just for you and your truth. How would you rank it, number one? What would be your number one, number two, and your number three ranking? So here we go. I'm hoping that this relates to people in the room. You really want to attend a training in an area that you have a lot of interest in, but you have to ask for time off, and you have to ask for some budget from your supervisor, and you're feeling a little bit tenuous because you recently had a vacation and took time off. So I'm just going to throw it out to the whole audience. What is your number one priority? What's your number two? And what's your number three? There's no wrong answer. Someone be brave and share. Objectives effectiveness is number one. I want to go to the training. What's your number two?
Relationship effectiveness.
Okay, because the relationship with the boss is important. And then self-respect is okay. Down a little bit from there. Okay, sounds good. Does someone have a different answer? And again, there's no right, no wrong. Maybe sometimes the objective is tied to self-respect. Those two could maybe be equal, and maybe the relationship is just one rung down.
You said it.
Oh, okay. I'm sorry I didn't see you. I'll hit you on this next one. Here's a different scenario.
What if you say your objective is yourself?
Right, that's what I'm saying. Yeah, so the objective might be taking care of myself is going to the training.
Yeah.
So it's self-respect and objective kind of are equal,
Regardless of what the outcome is.
regardless of what the outcome is. Okay. Okay, here's another one. You manage a team of people, and you feel like the behavior of one of your team is negatively affecting the rest. You need to sit down and talk to this person. So what's your number one? What's your number two? What's your number
I
three?
see some smiles on this.
Can anyone relate to this? What were you going to say over here? Relationship. Thank you, Lisa. Relationship's number one. What's number two? Self-respect of the supervisor. What about the objective of doing the conversation with the employee?
Honoring their self-respect. Maybe honoring their.
Wait, who was speaking? Because I didn't catch up. Oh, okay. Oh, okay.
So
Honoring their self-respect.
just honoring them, their, respecting them.
Respecting them.
Conversation.
And I would look at that as relationship effectiveness, is honoring that person and what they need. Okay, so is there another version or a different option?
Considering where they're coming from, their viewpoint.
Absolutely. Well, yeah, this is just the sitting down and doing the conversation. It's kind of ranking your priorities just to do the conversation. But I hope that they're going to sit down and really listen and have a good, healthy, two-way conversation about the behavior. Okay, does anyone have a different option, a different ranking? Okie doke, I got one more for you. And then we will move to mindfulness. Well, actually, let's not. Let's just wrap it up there, and then we'll shift to mindfulness. But do you guys get a sense of what I'm doing? And the reason I'm having you look at ranking priorities is because it's a different skill. Or we would lean one skill versus another skill based on the ranking of your priorities. Okay, so Yvette's going to take us through a final mindfulness.
Okay, on this mindfulness, mindfulness DBT is about awareness and being present in your life. And this is kind of a nice way to send you off so that you're fully present in your life and not in your thoughts, what I need to do, and what have I done to get here. So again, let's go back to your awake stance, which is feet is on the floor, and maybe your hands are in open position. If you want to be truly mindful, your eyes are open and gazed at an object and slowly fuzzy out the vision. Because life happens with your eyes open, not closed, if you can. All right, let us begin. So as you're finding your comfortable position, I'm going to ask you, or I'm going to state some questions. And just focus on what comes up for you, not out loud, to yourself. So focus on your breathing. Can you feel your hair touching your head? Can you feel your belly rising and falling as you breathe? Can you feel the space between your eyes? How about the distance between your ears? Can you feel your breath touching the back of your eyes while you inhale? Can you picture something far away? Can you feel the bottom of your feet? Can you imagine a beautiful day at the beach? Can you notice the space within your mouth? Can you feel a breeze against your cheek? Can you feel the temperature change in the air around you? Can you allow yourself to drift lazily? Can you imagine a beautiful flower? Can Can you imagine this presentation being over?
Thank you so much. I'd like to invite Dr. Nanja up again, and thank you so much. It was a wonderful presentation. We have just about 4 minutes for some quick questions and answers. So if anyone has a question, please raise your hand. I also will leave you with, please help yourself to any desserts or coffee out after the presentation has ended. There's all sorts of material on Good Samaritan Hospital's behavioral health services. Help yourself. If you have any questions on our program, I've left my cards. Feel free to contact us. And I know everyone here, Awake DBT and Dr. Nanja, also have some material out as well. So thank you again for coming. And if we have just a few minutes, we'll have a few questions and answers.
I have a question. What kind of therapy is involved in the inpatient admission?
Is that more you
Is
question?
it DBT or all sorts of things?
Is there a better person here to answer that question who does more inpatient work than me? So DBT and process groups.
Many different treatment modalities, inpatient psychiatric stabilization that incorporates acute medication management, DBT, CBT, process groups, yeah, that's right, occupational therapy, art therapy, everything that we can to help the patient heal and get to the next level of care.
I haven't found data on supplements that are helpful for schizophrenia. Schizophrenia is more of a biological condition. More important with that condition, I recommend family involvement. Often insight has a lot to do with outcomes along with family support. And so it's more family work and also the rehabilitation model of trying to get clients back into full functioning mode. So it's more of a rehabilitation approach. Yeah. Yeah.
You mentioned some supplements that you use for yourself in your own treatment, especially like omega-3. Is there some data around that would be helpful?
So now you're talking about depression. So we don't have that for schizophrenia.
No, I wasn't asking specifically about schizophrenia.
Okay.
I was asking about the principle of recommending supplements.
So for any psychiatric condition,
Any psychiatric.
yeah. I think we should be open to that. I'm not as clear about what you're trying to ask, but in my practice, and in general, I think as providers, we should be trying to stay up to date on data for supplements and the goods and the bads as well.
Absolutely. Thank you. Janice.
Thank you, Dr. Nanja, for sharing your personal story. How did that affect your treatment with your patients after you went through that?
It was very humbling, and to be someone who knows one side of the chair, to be sitting on the other side, I think it helped me bring more acceptance and patience and compassion to my clients.
Okay. Thank you all again. That was wonderful. Thank you.